Hi, and welcome back to Sisterhood in Surgery. Our March edition is about cultivating wellness in the medical profession. And our esteemed guest today is Dr. Dharam Kaushik, who is a urologist here at Methodist, and of course my co-host, Dr. Palma Shah. And so when I asked him to be on the show and send me his resume, it was 23 pages, and I was trying to cancel the print, but so his resume is exceptional. He's a board-certified urologist. He's published numerous research articles in his specialty, but he also has a special interest in cultivating wellness in the medical profession. During the COVID pandemic, he decided to train to become a certified yoga instructor to address burnout in healthcare professionals. And since February 2022, he has been teaching free weekend classes on yoga and mindfulness, breath work for faculty and other medical staff. He's also designed a curriculum to improve ergonomics of a urologic surgeon by incorporating yoga postures in an exercise schedule. He's not only participated in multiple podcasts and editorials, but his expertise has also translated into research grants to evaluate a role of yoga intervention on quality of life, immune and pro-inflammatory biomarkers in prostate cancer patients scheduled for radical prostatectomy. Welcome.
Thank you, Linda, for having me on this show. I'm honored, and I look forward to this, our conversation.
Yes, definitely. And we've been planning this, and we actually have some volunteers later on the show. And Palma, you want to go through the main talking points today?
Sure. This is such a great topic. We've previously touched on mind and body and some wellness points, and then we've additionally done a whole show on ergonomics, which is very well received. So this is sort of bringing the two together. And we really appreciate Dharam coming together to help us figure out in our busy lives how we integrate this into our daily life. We'd like to cover how we cultivate, promote well-being in the medical field. And we want to touch a little bit about women and how that is unique and how we can integrate this into our daily life. We'd like to talk about how ergonomics can apply to healthcare professionals, and also point out that many of the surgeons have poor ergonomic postures and practices that ultimately can relate and develop into injuries. So we'd like to hear more about how to avoid that.
So what motivated you during the COVID pandemic to start this? I mean, so you're rather new, but I've in the yoga world, but I've heard your class is very tough, very hot, obviously, but very tough, and that you're really good and you push everyone to the next level.
Yeah, so thank you for that. So it's all started in pandemic. Everyone, I think every single healthcare worker I know in pandemic had an epiphany of what's the purpose of their life, what's the meaning of their life, what they want to do in their life. I realized a few months into the pandemic that I was experiencing burnout. I listened to my wife tell me, you're not doing well, you're pushing yourself too much at work. I was in San Antonio, and we were experiencing tremendous amount of surgical volume because every single hospital around our site was shut down. So we were operating a lot on cancer patient. And few months into it, I experienced tremendous burnout. And I thought to myself, I need to address it. So I tried different things. I tried running, I tried biking, but then I found this studio, yoga studio, where I took classes for a few months, and I started feeling better, mentally, emotionally, physically, just overall sense of well-being. So much that I thought to myself, I'm feeling better, but my colleagues in my surgery colleagues are not. And I felt almost some kind of guilt of not sharing this with them. Even though I will tell them, let's go and take yoga class together, it was not the same. So I thought to myself, is there anything I can do to help my tribe, which is surgeons, my healthcare professionals who interact with me on daily basis. Can I do anything for them? And at that point, I decided, you know what, I'm going to train to become a certified yoga teacher. So on my weekends, when I was not on call, not operating, I joined a program. It was a 1-year program where I trained on weekends, Friday, Saturday, Sunday, to become a certified yoga teacher. Now, during that training, I focused on how all these poses relate to ergonomics of a healthcare worker. I saw it from a viewpoint of a surgeon. How can I leverage all these poses, 200 of these poses, into developing some kind of curriculum I can design and implement for healthcare workers? So I finished training, and then in February of 2022, I started doing classes in San Antonio. Initially, I thought I'll be just doing it with few of my friends, colleagues, some my coworkers, but it evolved into training a lot of healthcare workers in San Antonio.
That's really cool. Yeah. And Palma, you were talking about just neck pain and just from vascular procedures of wearing lead and loops.
Yeah, definitely. I find that if I interrupt my workout schedule, even if I cheat for a week, let's say, you just get real busy, you're on call, we have 100 reasons to not work out, but then even wearing the lead, my back is sore, I feel worse, I feel even more tired at the end of the day. So I would agree with you, it's a real stress reliever. If you can find that magic thing that connects you to some peace of mind.
Yeah, absolutely. So I think we as healthcare workers, we especially in surgical field, we have a very high rate of musculoskeletal injuries, neck pain, back pain. You talk to any surgeon and you ask them, do you have back pain? The answer is always yes. Why is that? Because look at the way we operate. We are either hunched over or we are bent forward. We are over recruiting the muscles we don't work out, and we are not using the big group of muscles we are so used to working out. That puts a lot of strain on our spine, neck, and that results in some surgeons retiring early or ending their careers.
Yeah, absolutely. My chief in fellowship, he had a spine procedure because he's so tall, and he was saying it's because I'm always leaning like this down because he's over 6 feet. But so how did you get involved? I mean, how did you get your grants for this? And tell us more about that.
So I did not try anything. I just started. I didn't look for any grant, anything. I just started teaching. Because my goal was, when we talk about suffering in medicine, and that's suffering for patient, but when you talk about suffering of healthcare worker, what we go through, how much we emotional turmoil, mental turmoil we go through. So when you see that suffering with your colleagues, with your coworkers, and you have experienced yourself that suffering, then you want to do something kind of almost unconditionally. So I didn't try for any grant or anything. I just started teaching classes, and slowly the word got out, and then there were few regional agencies who reached out to me. It's like, hey, we heard you're doing this work. Can we support you?
Wow. Okay.
And yeah, sure. One of my patients heard about this, and he asked me, can I support you? Because this is a very, very unique thing you're doing. Sure. So that's how the word got out, and people started helping. We built a community where everyone was helping with small funding, big funding.
Wow, that's really cool. And so do you, how did you become aware that there's such a gender disparity in terms of women versus men in the OR? I mean, you being a male yourself, like how did that come about?
That's a good point. The answer is I have 3 daughters, teenage daughters, and we talk a lot about disparity. And I'm very aware of disparity.
Yeah.
And then when I started teaching classes, most of my female attendees in the class, they would send me feedback on like, hey, Dr. Kaushik, I did this class and my wrist feels so much better, my back pain is gone, my neck pain is gone. And I started thinking about this. Then I started observing what's happening in the operating room. If you look at the operating room, it's all designed for a big male surgeon. All the instruments, all the equipments are designed from a viewpoint of a male surgeon. And that, for example, interventional radiologist or you do vascular procedures, you wear a lead. How many times you have the perfect fitting lead? Either it's too bulky because it was designed for a male wearing that lead, or too heavy and you're wearing that lead for hours and hours in a day, and that puts a strain on your back, your neck, and simple things like a big instrument designed for a male surgeon. For example, we have an instrument tray here. We'll go over this tray, but everything in the operating room is geared toward helping a male surgeon do the surgery.
Yeah, I mean, we were doing some practice before, and a lot of things that it would take a man one hand, it would take me 2. Or I know we've had a company that came. So the idea was weightless lead. Palma, have you seen this?
The zero gravity lead.
The zero gravity lead. So they try to fit. There's a couple of male surgeons here that have it. And they try to fit me for it, and I was too short. The company did not, because it's custom fitted to you, but they only have like certain parts of it, and they actually couldn't make me the zero gravity lead because the fulcrum here for the knee down to the foot, I'm short, so they didn't make a short enough piece of metal for that, so I never got one. But
because it's not in their radar.
Exactly, it's not in the radar. And the company was actually kind of embarrassed because I said, well, so if you only have lead for 5, 6 or higher, do you realize that many women are not? So how does that? And so they were like, okay, we have to bring this back to the engineers and et cetera. But I have not heard from them since, and this was like 2 years ago about. But yeah, it was. They didn't even make it for women or for shorter people. So.
But I find that interesting that you brought that up, because if you really think about how women have struggled to be equal to men in the surgical realm, think of 10 years ago, women come in, there's very few women, and we appeared to be struggling. Maybe it's exactly for the reason that you've just said, that the rooms were created, the instruments were created for men, and the women were struggling. So the men felt that we just couldn't do it, or we were in the wrong specialty. And then the women feel internally that, why am I struggling? Maybe they're right. Maybe I don't belong in this field. So I think it's interesting that you bring that up. I never really thought about it.
Yeah, it's a vicious cycle. I mean, overall bigger picture here is, in I think 2019 is when we had more female medical students for the first time than male students. So the demographic of medicine is changing rapidly. And I think it falls on us, on the institution, on the leadership, and us to address that if we don't talk about this, then we are looking at ending the careers of those healthcare workers who could be making valuable contribution to the society. Simple example, I know we were practicing, let's go over this. So this is a rib cutter. This is supposed to be one hand, you put the bone and you just crush it and it's done. For a male surgeon, this is straightforward. It's designed for a male surgeon. But let's see if what happens with Linda here.
I wear a size 6 glove. I used to be a 5.5. That was before the baby. I'm just kidding. But yeah, for me, it's uncomfortable to actually extend that much. So I always have to use my left hand if I'm going to use this instrument. And I was telling Darm, this is actually average. I mean, there's other instruments that are even larger than this, right, Palma? I mean, when we do, we use the saw, things like that. I mean, they're very
bulky.
Bulky, yes. Yeah.
Even positioning when you're going to do an amputation and using the striker saw, I feel like I need my whole body over that area to be steady, whereas perhaps a man maybe doesn't have to make those adjustments to his body positioning.
Yeah.
So that's a disparity right there. When we, excuse me, when we talk about disparity, I think there are certain things very tangible we can address and change, which require a conversation, which requires the institution to support these conversations. So I think having instruments designed for women in medicine, female surgeons who are spending 8, 10, 12, I don't know, sometimes 14, 16 hours in the operating room, going through this motion of squeezing this 100 times, how much trauma that translates into the not only the hand muscles, but also that transmitted to the neck and the spine. So then again, that comes to your point, is like, then we start talking about like, why is the female surgeon disparity, we start talking about, I don't know if I'm the right fit in this surgical field because I cannot do this, or the system is rigged for a female surgeon.
Well, and, we're doing some research on this topic, and, as you were saying, females have some of the highest rates of musculoskeletal injuries. But of course, in any surgical field, especially the male-dominated fields, I feel like there's this stigma the stigma of like, I cannot admit that I'm tired or I'm aching or I'm hurting, because that's a sign of weakness. And so until that really becomes acceptable, and I say this all the time about aortic surgeries, Palma, I don't know how you feel, but with aortic surgeries, it wears me out. I mean, not so much mentally, but the physical aspect of like, okay, so you have like the Volkwalter or the, big retractors, and they're sticking out. I'm short, so I'm, having to lean over the retractor. So I'm more, leaning this way into a deep, and especially if the patient is bigger, by the time it's done, the next day I cannot even move my neck. Palma, what are your thoughts on that?
That is the same thing for me, and I think that the open aortas we're doing now are much harder, right, than before.
They are.
Long neck open aorta, they're all getting stent grafted, right? And then the stent graft cases where you want the imaging, maybe the table isn't set up to do an open component. So if you're doing a cut down and something additional, you're leaning over this awkward table, you don't have the right retractors because you want the hybrid room. So there's a lot of ways we're trying to compensate, and we're totally ergonomically off balance, by the way, and we feel it heavily the next day. I completely agree with you. Thank God for Advil.
So just think about the sustainability of that, doing it every day for years and years, how much trauma your body can handle.
Right. Do you think, and this will be kind of the last question before we go into the yoga component of it, do you think laparoscopic or robotic is improving this? I mean, or especially robotics, since we're starting the vascular robotics program here. Can you comment on that?
Yes, so absolutely. So I've done special classes for robotic surgeons because robotic surgeons have a unique set of injuries.
Okay.
So so the open surgeon used to be more lower back because they're, as you mentioned, you're bending over the book vaulter or Thompson retractor. Robotic surgeons have more upper back and thoracic and neck injuries because they are not taught. You have a $4.5 million machine, but you're not taught how to take care of yourself. Most robotic surgeons, when they sit, they put their forehead on the robot console and they press.
Yeah.
And if there's bleeding, they press more because they're trying to get to the pedal, right?
Yes, yes.
But what that does is, think about what it does. It's transmitting that pressure back here to your neck. Plus, we don't ergonomically design our sitting for the robot. Means what I've seen, and I correct my resident and fellows all the time, is you don't want to be like this, and you don't want to be like doing this. You want to be this, elbows close, and you want to be doing more wrist, and you should not be doing this, you should be doing this. But we're not taught that.
Yeah.
That comes from, personally experiencing those injuries and then watching other, and then, applying what I learned in yoga to improve that.
You're absolutely right. When something gets harder on the robot, as a beginner robot person, it's like I'm just trying to get closer to this grip by pushing more.
Yeah.
Palma, have you practiced on the robot?
No, I haven't.
Okay.
But,
It's a whole new world, because in order to even get the robot started, or you have to put it has sensors where you put your head here.
Yes.
And so
the console
the console to activate the robot arms even to move it. And so before it's like you just do this and you're just doing this the whole time. When practicing afterwards, I felt sore in different areas that I've never felt sore before. I'm like, why is my this hurt, like my elbows hurting and my this part hurting. So so now I'll just have injuries like all over, because
and it's also hip injuries, because for female surgeons who are shorter, the robot console doesn't come out all the way. Plus they have to do this to reach.
Yes. Yeah.
Right. So you have a difficult case. You're pressing your forehead. I can tell. You get I call it the Da Vinci mark, because the forehead is all it's all red.
Yeah.
So you had a difficult case. How do you know? Because you got the Da Vinci mark.
Yeah.
So that's one thing. Other thing I've noticed, and I get this feedback a lot from my yoga attendees, is like, my hip is hurting because I did robotic surgery for last 2 weeks. Like, okay, that makes sense, because poor ergonomics.
Yeah.
We have female pregnant surgeons who are working through pregnancy.
Oh, yes,
who are experiencing
please.
different ergonomic. You did it yourself. I mean,
oh my gosh. Oh God.
Not that long ago.
Yeah. I mean,
right?
talk about the lymphedema. Well, I've mentioned that on the show before. Everybody kept thinking I had preeclampsia. They're like, you're so swollen. But my last case before I went out was an aorta bifem, and I barely survived that. It was 4 hours, and I had to sit down afterwards because, again, like open aorta, big retractor, I'm short. Now my belly's out to here. And so I was like, almost like this. I mean, it was so uncomfortable. And so and then the lead. I mean, when you have to wear it for vascular, when you have to wear lead pregnant. So it's really, I can only imagine doing it now. I can't even, well, I can't, but I mean, Palma, you went through it too, twice.
Yeah, I double-letted. I double-letted through 2 pregnancies, and you didn't even need to. But
Yeah.
I think if there's specific exercises that, he can comment on for pregnant women that may watch this show, I think that would be great.
Pregnancy, of course, it's a very challenging, ergonomic, unique situation, and for a female busy surgeon to go through a full pregnancy, still operate, that just so much is going on your body at that time. There are so many possibilities of something really bad happening as far as musculoskeletal injuries. So when I teach yoga, I have not incorporated pregnancy in the yoga sequence, but I'm looking into it because I get a lot of requests for that also. And I would say the simplest thing at that time, if you are a surgeon and you're pregnant, and all you need to do is stretch as much as your body allows you. For example, that can be for robotic surgeon who's pregnant. Again, they complain a lot of neck pain. All they need to do is just go against a wall and stretch their shoulder back and forth, and touch the shoulder blades and the neck to the wall. And that kind of addresses some of the musculoskeletal spasms during pregnancy.
Right.
But other than that, I've not looked into designing a curriculum for pregnant healthcare workers.
I mean, that's all.
When you do, we
Yeah.
want to highlight that on the show.
Yeah, for sure. Yeah,
Keep us informed.
All right, we're going to get, so our volunteers are here, so we're going to have them come on in.
Being a single mom, we've done so many shows that really emphasize the challenges that women face. And the ergonomics, interestingly, and now just illustrated by our guest, is really a problem. And I think until we put a microscope to it and we really evaluate it, I don't think women are going to get a fair shake in our presence in the operating room. I think that if we're in an ill-advised position, or if the instruments or the table is not set up, suppose the lights are too high, you can't reach, you're trying to jump up and pull them down, it sends a message to the people around you that, you're not quite fitting in here, and then you internalize that too. So I think it's important that we recognize that this is something outside of us that needs to be addressed. It's not that we're not good enough, and it's not that we don't deserve to feel well and be healthy. So I think the other thing I hopefully will cover is how do you actually integrate these exercises into our daily lives? Because we all have a million emails and 100 text pages and lots of things going on all the time. There's always patient calls to make. How do we interweave these exercises that he's discussing into our day-to-day life? So I'm interested in seeing the different poses and the different positions and how he advises us in integrating this going forward.
So we are here with Vascular surgery team. And I'm going to demonstrate a few poses which you can do if you have 5 minutes, 10 minutes. You're between cases, you're waiting for your patient to be roomed, your clinic is late, and you cannot go to a gym, but you have those 10 minutes. How would you like to spend those 10 minutes taking care of your body and your mind?
I'd like to ask, what is the purpose of yoga? How does that differentiate from a different athletic activity? Why is it so special?
So yoga, the emphasis, great question. So emphasis of yoga is on breath work. And the more we connect with our breath, the more we can connect with our sensations. And the more we are aware of our sensations in our body, the more we can go deeper into our mind. because whatever is happening in our mind flows through our sensation. So if we can figure out a way to understand our sensation using breath as a tool, we can get to deeper aspect of our mind, our emotional state, our mental state. And of course, you get all the physical benefits of doing various poses.
Do you think this can make somebody a better surgeon, being more in tune with your internal thoughts and the breathing?
So when I think about surgery, I think about mindfulness. When we are doing surgery, we are in that moment. We are thinking about the patient and what we are doing at that time, right? I mean, you guys agree?
Yeah.
Right?
Definitely.
You want to be in that moment. Give 100% of yourself to that patient who values your skills. So you are practicing mindfulness, and to cultivate that mindfulness, yoga is one way where it teaches us how we can cultivate being present in that moment. But yoga is not the only way. There are other things you can do. Any activity actually, any activity where you are being present in that moment, doing it mindfully, will contribute to growth of your personal and professional success.
That's great. Well, the vascular team is ready, huh?
So yes, we're ready for vascular team. I'm going to take you guys through, if you have 5 minutes, 10 minutes, what would you do? We don't have yoga mat, so we're not going to even worry about other poses. Simple, keep it very simple so that you can do it, you have more repetitions. So the focus is on breath. So I'll cue you, inhale, exhale, so just go with the flow, okay? So inhale, arms up. Now grab your left wrist with your right hand and swing it to the other side and see how far you can go. And as you are swinging through, rotate your torso toward the ceiling, a little bit open up to the ceiling. And now use your hand to pull your left arm. That's a side stretch. Come back to center. Now grab your right wrist with your left hand and swing it to the other side gently with mindfulness. Bring your awareness to your breath and open up the torso to the ceiling. Breathe in and breathe out. Breathe in, breathe out. Come back to center. From here, cactus your arms. Cactus arm and look up. Now slowly bring your hands to lower back and look up. Try to bring your elbows close and look up. From here, swing your arms up like this and then sit down. This is called chair pose. Utkat Asana, that's the name in Sanskrit. Chair pose. 80% of your weight is on your heels. 80%. 20% on your toes. Now go down. From here, tuck your tailbone in. And now tuck your tailbone out. Now find that middle place where it's not tucked in and it's not tucked out. From here, lift your arms up. Now this pose, you are recruiting all the big muscles of your body, the major big muscles. So I'm just going to go over the ergonomics here. So quadriceps, glutes, hamstrings, latissimus dorsi, trapezius, deltoids, biceps, triceps. And if I ask you to lift your heels up, then you're recruiting your ankle muscles and your feet muscle. Simple pose, but you're recruiting all the big group of muscles. From here, bring your hand to a heart center and rotate to the right, sorry. Bring your elbow close to your right knee. Your left elbow touches your right knee and look up to the ceiling. Feel that stretch on your neck. From here, come back to center and rotate to the left side. Chair pose with a twist. Breathe in, breathe out. The whole focus is on breath, and you're experiencing some sensation. We call it pain, we call it, you can name it, but it's just a sensation. It will come and it will go, it will pass. Bring your torso to the center, arms up and arms down. That's just a warm up here. So next one. So I thought about this sequence after doing robotic surgery because we heard a lot upper neck, back pain. So this is one sequence which works for me. So arms up and step your right leg forward, left leg back. This is called Warrior 1, Virbhadrasana Ekam. So right thigh is parallel to the ground. The knee is behind the right ankle, not beyond the right ankle. Left leg is straight. Outer edges of the left foot are in contact with the ground. Now here, from here go down, and now your torso is facing the front. From here, you can lift your arms up and look up. From here, cactus your arm. You have already practiced cactus. So feel that stretch on your upper back. And now bring your scapula close together. Feel that stretch. Look up. From here, Warrior 2, Virbhadrasana Dve. Warrior 2, you extend your arms and then you look at your fingertips. This is Warrior 2. From here, you can reverse your warrior, Viprit Virbhadrasana. Now what this is doing is you're opening up your rib cage, this part. Why is that important? Because think about when we do surgery, we're always sitting and we're always hunched over. So this opens up the rib cage, which increases our lung capacity. We can breathe better. And if you take deep breaths, that has a calming effect on your nervous system. It activates the parasympathetic nervous system and deactivates the sympathetic system. From here, back to Warrior 2. You're going to bring your right forearm down to your right thigh, left arm pointing to the screen, to the front of the room. This is the extended side angle pose. And if you can extend your right arm forward so you're grabbing something with both hands. Now in this pose, you have essentially locked your core. This is you're recruiting your core muscles to keep you in this pose. Extended side angle pose. Come back to warrior 2. From here, we can all face that way, and then come to a sumo squat, or what we call goddess pose. Come down here. From here, you just pulse 5 times, very small pulses. When you pulse, you are recruiting the smaller group of muscles. 1, 2, and synchronize your move with your breath. That's the key. When we synchronize our moves with awareness of breath, then it benefits our nervous system. We're activating the parasympathetic nervous system, which helps us think conceptually, relax. Now lift your right ankle up and pulse 5 times slowly. 1, 2, 3, 4, 5. Now bring your left ankle up, pulse 5 times. 1, 2, 3, 4, 5. Now lift, if you can, both ankles up and pulse 1, 2, 3, 4, 5. Back to the center. So we did the right side. We'll balance out the left side now. So left leg extends forward. You guys doing okay?
Yeah.
Yes, okay. Okay. So this is again warrior 1. Go through the checkpoints. Your left knee is not beyond the left ankle. Left thigh is parallel to the ground. Torso is facing front. Arms up. Warrior 1, Veerbhadrasana. From here, warrior 2. From here, reverse your warrior. And when you're reversing, your right hand can touch your thighs, and that will tell you where you are today. And as you practice, you will notice that the right hand can go lower and lower and lower. That means you're opening up your rib cage. Look up and back to warrior 2. Extended side angle. Left arm goes on the thigh. Right arm toward the windows. And you can extend your left arm. You're locking your core. Core muscles are not only the external oblique, internal obliques. These are psoas muscle. Back to warrior 2. From here, sumo squat on that side, or goddess pose. So we're going to squat, pulse 5 times. 1, 2, 3, 4, 5. Right ankle goes up and pulse 1, 2, 3, 4, 5. Left ankle goes up 1, 2, 3, 4, 5. Both ankles up 1, 2, 3, 4, 5, and back to the center. Now we practice mountain pose. Mountain pose, it tells us how to stand. So ground on the mound of your big toe, pinky toe, and heel. Distribute your weight equally on your feet, because most healthcare workers stand on one side or other side. And that creates a lot of back pain, back issues, hip issues. So we have to learn how to stand, be aware of our own body in the geospatial plane, how we are standing, how aware we are of our body. So equal distribution of weight on your feet. Your back, spine is long, neck is long, arms by your side.
Dharm, do you see a lot of piriformis strain? Because I feel like I get that a lot whenever I'm
One side or other side?
Yeah.
Yeah. So this is one, I think the main reason we're spending 8-10 hours. I've seen some surgeons, they take a step stool and they stand like this, or they're just standing like this, and again, there are a lot of tendons here connecting our lower back to the leg muscle, and you can have tendonitis, you can have muscular spasm. So much happens. So I think just correcting that by just learning how to put equal weight on your feet itself can be a game changer.
Yeah.
Yeah. So here, now gently bring awareness to your breath. And the reason is, sometimes we need some kind of framework within our body to deal with complexities of our life, deal with emotional turmoil, mental turmoil, and by making it something more tangible, something you can focus on, helps us kind of address the problem. As you practice yoga, you will start realizing that how deeply the mind and body are interconnected, inextricably linked with each other. Wherever the body sensation goes, the mind goes. Wherever the mind goes, the body sensation goes. And I think understanding that link, awareness, brings a newer meaning to wellness, well-being, taking care of your health. Because you're not just taking care of your physical health, you're taking care of your emotional health, your mental health, your physical health. So breathe in here and breathe out. And gently close your eyes and just feel the soft touch of your breath going through your nostril and coming out through your nostril. Breathe in, breathe out. Breathe in, breathe out. Okay, we'll do 3-part breathing together. So inhale for count of 3. 1, 2, 3. Hold. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Hold. 1, 2, 3. Exhale. 1, 2, 3. Last one. Inhale. 1, 2, 3. Sip more air. Sip more air in. Open your mouth and exhale everything out. You can do this in 10 minutes. Between cases, waiting for patients to be roomed. And that will be your wellness. You're giving back time to yourself. You're taking care of yourself so you can take care of other people.
That's a great point. And thank you, Dharm, so much for being our guest. And for anybody who's watching, he also does a class for healthcare workers. So if you want to just touch a little bit on that.
Sure.
He did one yoga class this morning already, but
Yeah, absolutely. Thank you for having me on your show. So I teach on weekends. I rent out a studio and I teach only healthcare workers, and it's free class. All you have to do is just show up with the yoga mat and water, and you can do a class with me. You have to just email me because I have limited slots and they all get booked. So just email me if you're interested. And also I teach at employees for Houston Methodist. I do yoga class, which is either you can join through team or you can show up in person. And third, whenever I'm doing my class for weekend, I live stream it on Instagram. So if you cannot make it, or if you are, there are a lot of people from out of state who join in to do a live stream from their homes. So if you are interested, you can join Instagram and follow me, and you can get the live stream version.
That's great. All right. Well, thank you, everyone. Great show. Thanks,
Thank
Palma.
you. Thank you for having me.
Yeah.
Thank you.
That was great. Terrific.